Hello everyone, thank you for joining in. Welcome to another session of Cancer Talk with Dignite. As you all know, Cancer Talk with Dignite has started with the intent of bringing on board cancer experts so that we could learn all the useful information and tips from them. And this session is specially conducted for newly diagnosed cancer patients and their caregivers. Today, we have Dr. Vaibhav Choudhary joining us for the session today. To give you a brief introduction about Dr. Vaibhav, he is a medical oncologist with over 9 years of experience. He is currently the head of the Department of Medical Oncology at Wockhardt Hospital in Nagpur. And he's completed his DM from the prestigious Tata Memorial Hospital in Mumbai. So with that, I welcome you, Dr. Vaibhav, to the interview. Thank you so much for taking time off and joining us. Okay. So to start off the session, today our focus would be on breast cancer and specifically chemotherapy on breast cancer. Right? So, Dr. Vaibhav, before we get into the treatment aspects of it, could you briefly explain the different stages of breast cancer and what are the stages where chemotherapy is applicable?
Yeah, exactly. Breast cancer actually presents, for that matter, any solid tumor malignancy presents in four stages. That is stage 1, 2, 3, and 4. So, stage 1 and 2 are considered early stages where surgery has a primary role, and depending upon the status, the extent of the disease, radiotherapy and chemotherapy are given. Stage 3 is a locally advanced disease where all the three modalities are required, like surgery, radiotherapy, and chemotherapy. And stage 4, mostly it is restricted to chemotherapy and targeted therapies which have come up. So these are actually four stages of breast cancer, and the treatment is according to the stage.
Okay. So you did mention about chemotherapy and targeted therapy, right? And also the new buzzword that is in most of the patient groups is around immunotherapy. So could you explain briefly about these individual treatment types?
Uh, Actually, chemotherapy, targeted therapy, and immunotherapy or hormone therapy, whatever it is basically a systemic therapy. What do you mean by systemic therapy is each and every cell of your body will be subjected to this therapy. In cancer, it is very important, especially in a breast cancer, where you do have some local spread, some systemic spread as well. And that is the whole idea behind giving such systemic therapies. Because if there is a breast cancer, you have operated, all right, the cancer is out of your body.
Yeah.
Then why you need to basically use chemotherapy, target therapy, immunotherapy, or for that matter, radiotherapy for consolidation? The answer to this question is that there is something called as micrometastatic disease. Like there are some cancer cells which escape your surgery and they might be flowing in patient's blood. So what happens is, as a lot of us know, that once the patient has been completely treated, surgery has been done, and the cancer comes back, right? So it comes back because these small micrometastatic disease already present in the blood, and the whole idea of giving this systemic therapy is to clear the whole body of this small cancerous cells so that that cancer never comes back.
Okay.
So in this phenomena, the chemotherapy is the oldest. Then hormone therapy also came quite a long while back. Target therapy is also for past 15, 20 years we are giving target therapies, and now immunotherapy has come up in last 4, 5 years.
Okay. Okay. And so basically, if a breast cancer patient walks in, right, how are the types of treatments decided, and what is there typically? How long does it take for the entire treatment to take place?
Yeah, exactly. When the patient comes, first of all, the diagnosis is done by a biopsy, and biopsy we have to do special tests of immunohistochemistry to categorize the tumor into whether it is estrogen receptor positive, progesterone receptor positive, and HER2 is one thing, that is human epidermal growth factor receptor.
Okay.
So biopsy and this immunohistochemistry are mandatory in every patient of breast cancer for diagnosis. Once this diagnosis is complete, then the next step is staging.
Okay.
Staging means we have to do scanning of the whole body to see whether the cancer is localized to the breast, or it has spread to the armpit, or it has spread to lungs, liver, brain. All these things we have to scan. This is called as staging. So
Okay.
first of all, diagnosis, then staging, and after staging, as per the stage, different treatments are decided. As I told you, that stage 1 and stage 2 are local diseases, very early stage diseases. So here, the predominant role here is surgery. Once you do a very good complete surgery, after that, you actually look into the surgical report. If you see that the axillary lymph nodes, armpit nodes are also positive, then the patient also requires radiotherapy also, which is given by means of machines of radiotherapy. And adjuvant chemotherapy is required plus minus targeted therapy, depending upon the ER, and HER2 status.
Okay.
Now, for time, as you asked, the time for this is the adjuvant setting, this is a curative setting.
Okay.
Curative means we are going to treat the tumor for in one shot, and then after a treatment period, patient will be cured for the rest of the life. Rest of the life, patient doesn't need to take any treatment. This is the difference between early stage breast cancer and stage 4 breast cancer. I will
Okay.
come to stage 4 later. So
Okay.
this is the answer regarding the early stage breast cancer. Patient comes, we do a surgery. If it is very small, we do a surgery. If it is a bit large, maybe stage 3, we first give chemotherapy, shrink the tumor, and then do surgery. So
Okay.
in both the cases, surgery and chemotherapy are required for all these patients for cure of the patient. And depending upon the nodes, the positivity and all, the radiotherapy is given at the end.
Okay.
So as I see, there are some 8 cycles of chemotherapy which are required in adjuvant most of the time. If patient is HER2 positive, HER2 new positive, then a targeted therapy, trastuzumab, is also added to the chemotherapy, which has to be given for a year, complete
Okay.
year. Every
Okay.
21 days, that injection is given. And uh, after that, once the therapy is complete, then we actually put patient on a targeted therapy. If hormone receptors are positive, we
Mhm.
put patients on a small tablets of anti-hormonal agents like letrozole or tamoxifen. And as per the current guidelines, 5 years at least you have to give. 5 years patient has to take that hormone therapy. These are not chemotherapy drugs, these are targeted therapy drugs, which hormone therapy, in other words, which
Okay.
needs to be completed in a case of curative breast cancer, maybe stage 1, stage 2, stage 3. This is the
Okay.
treatment.
Okay. So,
If you look at stage 4,
yeah. Yeah.
right? Stage 4. Stage 4 is again a lot of the patients actually land up in stage 4 after being treated for stage 1, 2, 3, and in a year or 2 years, or maybe after that also the disease comes back. When
Mhm.
it comes back to lung, liver, and brain, it is actually stage 4.
Okay.
Sometimes at the presentation, the first time patient comes, maybe she might have ignored the symptoms earlier, and she as such presents in stage 4.
Hmm.
Like at the time of diagnosis, it is stage 4. Now, stage 4 breast cancer is a chronic disease. Now, what I mean by chronic disease is the treatment is never going to end here. You have to treat the patient till the patient is alive. It's just like, in other words, it's like diabetes, hypertension. Once the patient is diabetic, you need to give anti-diabetics or insulin till the patient is alive.
Yeah.
If a patient has hypertension, you have to give antihypertensive till the patient is alive. Same is the case in stage 4 breast cancer. We treat the patient with the same philosophy, and
Okay.
that's why we are moving away more and more away from chemotherapy, because chemotherapy, as you all know, cannot be given for lifelong, because ultimately side effects get better of you. It might be given at the max for 4 to 6 months. So the targeted therapies which have evolved over past 10-15 years, they can be given for years together, and we have survival in the tune of some 8 to 10 years as well in stage 4 setting as well in breast cancer. That is a very positive sign, because patient just takes a pill and patient is good for years together.
Oh, that's really reassuring for other patients to know that the survival is increasing. And so, moving on to the other aspects of chemotherapy, which is the most concerning aspect for most patients, which is the side effects, right? So there is a lot of, I think there's a lot of positives and negatives around this. So can we speak about what are the side effects of chemotherapy during the session? And also, after the treatment ends, are there any permanent side effects that might result?
Yeah. All said and done, chemotherapy still is a gold standard in adjuvant setting, in curative setting. So barring a few instances like very very small tumor, very, and there is a test called as oncotype DF, if that is positive as a low risk, then only we can actually avoid chemotherapy in patients. Otherwise, the tumor which is more than 1 centimeter in size, even if the nodes are not positive, then
Mhm.
ultimately we have to give patient some chemotherapy, maybe 6 to 8 cycles of chemotherapy.
Okay.
So we need to cope with it, and proper patient education is very, very important in such instances, because anyway you have to give chemotherapy. Chemotherapies are cytotoxic chemotherapy. What it does, what is the cause of side effect of chemotherapy?
Hmm.
It is designed to kill cells. It is designed to kill cancer cells. It kills the cancer cells, but subsequently it also damages. It causes a bit of a collateral damage to the normal cells as well. So the highly dividing cells of our body, like our oral mucosa, our gastrointestinal system, these are actually damaged because they divide very fast. So patient might have some oral ulcers, mucositis. So we give actually preventive therapy for that. We give some oral gels, we give some antifungal tablets and all to avoid that. That is after effect of chemotherapy. Just once we give chemotherapy, the more menacing things with chemotherapy were nausea and vomiting, right? I said where because now we have got such great drugs to stop that symptom. That's a menacing symptom, because sometimes patients are so anxious that even before the drug goes in, patient starts vomiting. This happens in this is a known phenomenon. This is called anticipatory vomiting. So
Okay.
young patients are more apprehensive. They also actually they are more apprehensive. They're at high risk of vomiting. So it actually the stigma and fear of chemotherapy was more because of this side effect, but this has been taken care of because
Okay.
now we have got n number of very good drugs which are very strong in stopping this MSS, that is nausea and vomiting.
Okay.
Uh, Started from palnoseptron, fosaprepitant, fosaprepitant. Now mutapitant has come, and these are strong drugs. So that is not a significant problem now. Vomiting, which was associated with chemotherapy for years together, it is not a significant problem now. Now the problems are a bit different. It is like once we give chemotherapy, and on 7th to 8th day, the body's immunity comes down. And
Hmm.
at that time, patient actually is susceptible to some infections. Because the defense mechanism has come down, the WBC count, our defender cells are down because of chemotherapy only, because it kills the cells.
Hmm.
And that thing actually recovers in 4 or 5 days. So potentially 7th to 12th day after any chemotherapy cycle is a bit risky. At that time, you have to do a blood test and check whether the blood counts are normal or less. We actually can give some injections to increase the blood count and increase the immunity at that time, and that usually subsides if it is less. Sometimes patient might not have that problem, so that's why we need checking and giving growth factors then and there if it is drastically low. In some protocols like dose-length chemotherapy, where we give every 15 days, it is in the protocol itself. Like today, I give chemotherapy, I will give a growth factor, pegylated growth factor, on day 3, third day of chemotherapy, so that it will also act, and on 8 to 10 day, its effect will be maximum, and the blood count will not go down. So that serious adverse event is also avoided in most of the cases.
Okay.
So that also, with proper medication or proper treatment, these things are avoided.
Okay.
Uh, Bearing all these things as well, some patients are fragile. They anyhow will have some symptoms. And the biggest thing for worry in females is alopecia, that is loss of hair.
Yeah.
Loss of hair is real, loss of hair is true. There are certain places where this scalp pulling mechanism is being used while giving chemotherapy. I know of a few centers in India as well, and they are doing it successfully. But in a lot of places in India, maybe maximal places, people don't have that much of benefit and don't trust that thing as well.
Hmm.
So, what we do is we counsel the patient that hairs are going to go, not immediately after giving chemo, but maybe after 2 3 cycles. It goes completely after some 7 8 cycles of the chemotherapy. But the good point here is it is reversible. It completely comes back after 3 months of completion of therapy, because lifelong you are not going to give chemotherapy. It's only for 4 to 6 months, and after that, once you stop chemotherapy, the hair growth recovers. In the meanwhile, if the lady is working, she is too apprehensive and all, she might use hair wigs and all those things are there to help her cope up in this situation.
Okay.
There are broad side effects. There are many which are attributed to simple drugs, and they are actually standard guidelines and protocols for that. So there is nothing to be scared of. Chemotherapy is not poison. Ultimately, it's a medicine. So that we have to keep in mind.
Yeah. So I think to summarize the points around chemotherapy and side effects that you mentioned, the first one, which is nausea, which is the most menacing symptom, but there is enough advancement in this area to ensure that they are not that nausea can be managed. The second, you did mention around oral ulcers and other problems, and you said there were good medicines to manage those as well. The third, you mentioned about
Yeah.
hair fall as a symptom. And see, this is completely reversible. There are scalp cooling options available in case patients want, but this is only for a duration of say 5 to 6 months during the treatment, and then they regrow their hair, right? Okay, great. Because I think chemotherapy and side effects is one of the biggest myths, that most of the patients have. And in this particular context, there is a lot of, I don't know, miscommunication or misunderstanding around Ayurveda and other natural treatments that people will go searching for, right? And most of the forums have discussions around people asking for natural solutions for cancer, right? So in those cases, what is the message that you want to give
I'm not trained in Ayurveda, so I cannot speak for them what medicine they are giving. But what we practice in cancer as such is a difficult disease to treat. So what we practice is evidence-based medicine. What do we mean by evidence-based? Is it has been tried and tested on thousands and lakhs of patients over the years, and we have very robust and strong data that if I treat the patient this way, then patient will survive for a longer and longer time. So with that thing, we actually don't entertain any perturbations in that and any addition to that. We don't require addition of homeopathic or Ayurvedic medicine to our medicine to cope up with the side effects. People do try some herbal things and all, but with a word of caution because they might actually interfere with the allopathy medicines
them?
and their effect, their excretion. Sometimes you don't know that you get these Ayurvedic medicines from unspecified sources, and then it might even harm you as well. So I cannot speak on their behalf whether it works or not works. That's for the Ayurvedic prescriber to tell. What I can tell is in allopathy, the chemotherapy and the hormone therapy and the target therapy, they are designed to take care of the cancer on their own. And the drugs for side effects are also in allopathy only. So someone, people actually, they in India especially, naturopathy and all these things, inclinations are there.
Yeah.
Sometimes what I request to these people is you at least stick to the protocol because every 15 days you will have to receive chemotherapy. You cannot delay it because you are taking Ayurvedic. You should not mingle with the protocol. If you complete the protocol, you have got the best chance to defeat cancer. Otherwise, half-heartedly treating this disease is actually very, very dangerous. Disease might come back in between as well if we break the protocols. So there should not be any interference.
Okay, okay. So I think my next question is specifically focusing on younger women who might have breast cancer, probably in their late 20s or 30s, right? The first aspect of this question is if they're working professionals, how will their work life hamper and how can they manage that? Because if you have any examples of working women who have undergone treatment and managed both, that is the first one. And the second thing is also for women who might want to conceive at a later point in life because who are fairly younger and got diagnosed. So how does these two aspects change for women who have been diagnosed with breast cancer?
Yeah, very, very important question because more and more we are seeing that breast cancer is also seen in younger women, maybe in their 20s and 30s. A specific variety of breast cancer occurs in these young patients. It is very commonly associated with a gene BRCA, which is genetically linked.
Yeah.
So we have to look in a holistic manner. We have to take a proper history of the patient, whether patient has other cases in the family like mother and aunts, sisters, and all, because they also might be having that mutation. This is after the mutation testing.
Okay.
So that is altogether a different aspect in young patient, but it is very important. That's why I highlighted it because as such, cancer is a disease of the old. Majority of the breast cancers will occur after 60 years.
Mhm.
It is
Okay.
rare to occur earlier. If it occurs so early in 20s, then you have to actually look at it with a bit of a degree of suspicion that it might be something else. It might be genetically linked as well because they occur early. Now, for a lady who is working and has cancer, so it's not such a big deal actually. What happens is you undergo surgery. Surgery nowadays they do breast conserving surgery. They are very small incisions. Maybe in a week's time or 10 days, you are good again to join the duty.
Okay.
Once, yeah, maybe 10 days you can again join the duty. It's not an issue at all. You can easily take a leave for some time to recover from surgery. It's a small surgery, very easy surgery as well as compared to other complex surgeries in intra-abdominal cancers and all. This is a simple surgery. Then chemotherapy part, what happens is, like as I told you, that there are so many good drugs that patient will be symptom free if she sticks to the protocol which I have prescribed for supportive medicines. So there will not be very troublesome vomiting, there will not be any troublesome weakness, blood counts also we will monitor. So patients actually in cities actually reach the fact that if a woman working, they actually take chemotherapy and then go to their offices as well on the same day as well. It's not like that patient has to do a bed rest for 24 hours, 1 year, 1 or 2 days, 3 days, or even for the whole period, 4 to 6 months, patient cannot go outside the house. It's not like that at all. Chemotherapy is just like any other medicine which you give, and if you take care of the side effect and you take precautions, you can easily do light work, desk work, not very obviously, not physical labor and all should not be done, but office work can easily be managed. A lot of my patients actually who took chemotherapy not only in breast cancer, in other cancers, colon cancer and all, they were able to carry out their work.
Okay.
But then light work is required, light work, not heavy work.
Okay. Okay. So this answers the first part of the question, which is around how do you manage your professional life along with the treatment. The second question is around women who are planning to conceive, right? If there is,
Yeah.
so how does that get?
See, now, yeah, here actually there are a lot of studies which show that if you give some sort of a hormone therapy along with chemotherapy, because chemotherapy obviously surgery will not hamper, breast surgery will not hamper the ability to bear children in the future. Radiotherapy also will be in the upper part, so it will not hamper the ovaries and all the reproductive function. But chemotherapy, obviously, there is a bit of a chance because it stops menstruation for time being, and sometimes, in some cases, it may actually irreversibly stop the functions of ovary and child producing ability of the young woman.
Okay.
Here, the rates are different. It's not an absolute phenomenon. The patients who are 35 years and elder are at a higher risk of permanent infertility because of chemotherapy. Those patients who are younger, maybe 25 to 30 years, they have a fair chance to regain their menstruation after the chemotherapy is successfully completed.
Okay.
In addition, because this is a global phenomenon, so a lot of research has gone in. There are some injections which are given with chemotherapy, which protect your ovaries while chemotherapy cycles are given, and which protect your fertility as well. So
Okay.
those protocols are there in young women. We actually counsel them that okay, you will have to add this hormonal agent along with chemotherapy to preserve your fertility if you wish to conceive in future. The problem here is in hormone receptor positive patient, there are hormone therapy which needs to be continued for 5 years,
Hmm.
and uh, at that time it is not advisable to conceive because it
Okay.
might damage the child. It will not cause infertility, but it has got some teratogenic effect on the child. So whenever the lady wants to conceive, she should consult the doctor, and once that hormone therapy is over, at that time, the doctor and the fertility expert and the patient should make a combined decision that now we want to go in for conceiving.
Okay.
Okay, so it has to be in a planned manner. It's not like it is impossible. I have seen instances where unfortunately the lady has got cancer while being pregnant, maybe
Oh, okay.
second trimester of pregnancy, third trimester of pregnancy, and there is a lump. And then you find, okay, it's cancer, you do biopsy, you find it's cancer. Then there are special protocols for that.
Oh,
Even we have given chemotherapy. Even we have given chemotherapy. There is a series. I come from Tata Hospital. We had a series of some 45 patients where they came in a pregnant state and they had cancer, and we had treated them successfully. And most of the cases actually delivered a normal, healthy child. But here, once the delivery is there, after that, till the patient is taking chemotherapy, because these drugs are excreted in the breast milk, the mother should not breastfeed the child. The
okay.
child should be breastfed on the formula milk or something like that,
Okay.
because these drugs are excreted in the breast milk as well.
Okay.
So it's not such a hopeless situation as it seems. Things are possible in a good center, but requires coordination of 2 or 3 doctors.
Okay. Okay. That's very reassuring to know because I think this is the main concern for younger patients. And so moving on to the last aspect of the interview, which is around what are the basic tips or suggestions that you provide to patients and also their caregivers to mentally prepare themselves for chemotherapy? Right? What are the main points that they need to remember?
Yeah. First of all, there is a, very, what I will say, in India, there is a very bad tendency among the caregivers that they don't want to disclose everything to the patient. This is a cultural thing which actually we struggle to overcome. We as doctors are taught to tell everything in black and white to the patient about the diagnosis, the prognosis,
Yeah,
and the treatment plan, and take the patient into confidence. Then only you can actually do justice to the case.
yeah,
If you are, if because I am practicing oncologist for some now 8 9 years, so I have come across many instances where the patient's relatives would say don't disclose everything to the patient. Ultimately what happens is it hampers the treatment. If my patient is educated, if my patient, obviously there are ways to tell, and once the patient understands that it is for her own good, she complies by all your guidelines. So
yeah,
guidelines are not that great. Guidelines are very simple, very, very simple. It's like everyone is bothered about what to eat, what not to eat. I would just say eat healthy, eat less spicy food, don't eat anything from outside, homemade, less spicy, healthy diet, high protein diet.
yeah,
That is prescribed for everyone undergoing chemotherapy, because obviously chemotherapy will lead to some sort of hyperacidity. So spicy diet will not help you. It will lead
yeah,
to mucositis. So that is one thing. Second, simple precautions which we take. We should not go into crowded places. We should not live in an infected environment. It's not like a complete self isolation or quarantine like in case of COVID people are doing now. It's not like that.
yeah,
You are preferably you should stay indoors more of the time. You can take your morning walks. Actually it helps to do a slight bit of morning walk and mobilize and all, so that helps fighting the fatigue of chemotherapy as well. So it is not that strict that you are receiving chemotherapy, you can't do this, you can't do that. Actually, people cook as well. People do their light daily activity from second or third day of taking chemotherapy. As I told you, some of my patients go to their offices as well. But
mm,
they need to maintain certain cleanliness, hygiene, as well as nutrition. Nutrition is very important because patients' weight should not be lost while chemotherapy. It's a long thing. It actually goes on for 4 to 6 months. So the weight management should be there, because then toxicities start happening if weight decreases.
yeah, yeah, yeah. I think that's fair. That's fair. I think with that we cover all the aspects of all the questions that we had planned for this session. So in order to conclude, I'd like to say thank you so much, Dr. Vaibhav, for taking time off and coming and sharing these answers. I'm sure these are very useful and relevant to all patients and caregivers who are watching this. Thank you so much for your time.